Hi, folks. It's Marvin Music with MedicareSchool.com, and we want to welcome you to our live event today. I'm actually on the road traveling, and that's why we had to change the time. Normally, we try to do this a little bit later in the day, but I will be traveling at that same time. So we had to move it up a few hours, but we are glad that you have joined in, and I know those of you that are joining in right now want to make sure that you kind of know what exactly we're going to be doing today. I have a topic that we're going to cover for sure. Talk about the $6,330 hidden cost. I'll explain the details of that. And then also what I'm going to do, I'll be fielding questions for anywhere from an hour, hour and a half, really just as many as we have during this time frame. So I want to encourage you, if you have a question, to go ahead and start putting that in the chat very soon. I'll get to those here in just a few minutes, but I would also encourage you to stick around for a while because it does take a while for us to get through all the questions. But even if I haven't answered your question immediately, I'll get to it to be sure that you have an answer. And then also keep this in mind as we talk about today's topic. I am pretty fluent in Social Security as well. I'm actually a retirement advisor, so I'm very familiar with the Social Security system. I don't want to say I know everything about it, but I do know quite a bit about it. So if you have some questions about Social Security, feel free to ask those as well. So this does not just have to be Medicare related. I'm not an accountant. I'm a fiduciary investment advisor, so I'm familiar with some tax stuff, but I won't get any real tax details because I'm going to leave that to your CPA. But good general questions, anything about Medicare or Social Security, feel free to put those in the chat. I want to mention two other items. Every Monday at 5 o'clock Central Time, I have what we call Medicare Monday, where that's where I deal just exclusively with Medicare topics. And I usually go for about 30 or 40 minutes. And so if you'd like to ever be a part of that, we have a Facebook group now, I think about 50,000 people or so that are part of that. Those of you that are YouTube subscribers are always invited to that as well. And so if you'd like to be contacted by us, through email about notifications when we're doing educational events, you can either follow us, join the Facebook group, or you can become a subscriber on our YouTube channel, which is MedicareSchool.com. And just the other day, I was asking our producer, how many videos have we put out here in the last couple of years since COVID? And I've actually put out over 400 videos that are on a YouTube channel dealing with all kinds of Medicare topics and Social Security and those kinds of things. So if you want to get an education, which we'd encourage you to do before you start making Medicare decisions, then go to our YouTube channel. Of course, no cost to go there, but lots of wonderful information that I think will help you as you make your Medicare decisions and Social Security decisions. So avail yourself of that. And then if you need immediate help for really anything, just call the number that's on the bottom of the screen. Sometimes people are kind of down to the wire, have to make some decisions, so you'll see that number there. And that's going to go into our office. That's our home office, which is just right outside of Kansas City, Missouri, on the Kansas side, the suburb called Overland Park, Kansas. And that's our home office. Now, we do business in all 50 states around the country, as well as the District of Columbia. So we write business everywhere. But that is our home office. So when you call in there, tell the receptionist team what your needs are, and they'll actually direct you to the right department. And everyone you talk to, folks, I have personally trained. So they should have a good understanding of everything that you're asking and can give you that individual attention if that's something that you need. All right, now, if you are a client of ours, you put in the chat, hey, I'm a client and where you're from. We love to always hear where people are from that's joining this live stream event. And so if you'd like to do that, then please do. All right, so that's all the housekeeping business I want to take care of. Let's talk about the topic. And again, this is a Medicare-related subject, of course. Now, I want to talk first of all about Medicare A and B. I think the majority of you that are on here probably already know that Medicare Part A is a zero premium for the great majority of people. In fact, right now, Medicare says that only 1% of the Medicare population pays a premium for Medicare Part A. And the reason for that is because you and I, as we work, we are either paying self-employment taxes or we're paying FICA taxes. In other words, we are funding Medicare and Social Security through our payroll deductions or our self-employment taxes. And so as we fund Medicare and Social Security, what happens is Medicare says because you're paying a Medicare tax all your working life, which is right now 1.45%, your employer has to match that. If you're self-employed, you pay the full 2.90%. If you're high income, a couple above 250,000, an individual above 200,000, you pay actually an additional 0.90% above those thresholds. Now, here's my point. We pay Medicare taxes. And because we do that, as long as we have accumulated at least 40 quarters, which we get 4 quarters a year, so as long as we've paid into that tax system for at least 10 years, then we get Medicare Part A premium free. Okay, we don't want to say it's totally zero because you've been paying for it all your life, but they refer to that as Medicare A premium free. So there's no premium for Medicare A for 99% of you. Now, 1% of the population doesn't have 40 quarters and cannot get those 40 quarters from a spouse or an ex-spouse, so they have to buy Medicare Part A. This year, Part A, if we have 30 to 39 quarters, I think the price on that's going to be $258 a month. If you have less than 29 quarters, you have to buy Part A. I think it's $518 a month for a Part A if we have 29 quarters or less. Again, it's very few people, but my point is Part A is premium free for most of you. Now, when it comes to Part B, which is our topic today, of course, it's not going to be free unless you qualify for 100% Medicaid, which is pretty rare. So all of us, if we're enrolled in Medicare B, are going to have to pay a premium. And so the way this works, it has nothing to do with quarters. It has everything to do with your income. And so specifically, the income that Medicare is going to use to determine how much we pay for Part B is called our Modified Adjusted Gross Income. We use the acronym MAGI, Modified Adjusted Gross Income. Now, if I'm on Medicare this year in 2025, the Modified Adjusted Gross Income they're looking at goes back to 2023. They always look back 2 years unless we appeal or ask for a reconsideration. So the system automatically works that way. So we just rolled out of 2024. What were they doing? They were looking back at 2022 Modified Adjusted Gross Income. So automatically now they're looking at 2023 for this year of 2025. Now, if you're still not on Medicare and you're just making plans, clearly you can see that if you're going to start in 2026, they're going to look back at 2024. So let's look back 2 years. Now, the numbers they're looking back will be on your 1040, your tax return, which is line 11 plus line 2A. Now, line 11 almost always is going to be your adjusted gross income, AGI, adjusted gross income. So we have a few above the line deductions that come out of that, but basically it's all your income, adjusted gross income with a few deductions. Then we take the AGI, line 11, and we add back to that line 2A. 2A is the tax-exempt interest that you have to report on your federal return. Now, the majority of people that have tax-exempt interest have that because of municipal bonds and sometimes some U.S. savings bonds. But generally speaking, it's municipal bonds. And so what happens with municipal bonds, the returns, the gains, the interest we get off of those are not subject to federal income taxes. They're not subject to state sometimes they are. But the point is they're not federally taxed. But that tax-exempt interest still has to be reported on our return, and that is what box 2A is all about, tax-exempt interest. But when they're going to calculate for our Medicare premiums, they include tax-exempt interest. So they, again, take line 11 plus line 2A, and that's going to equal your modified adjusted gross income. And what happens is that number then is given to Medicare, which will then establish your Part B premiums based upon that number. All right, now, so what we have is we actually have 6 different levels of premiums for Medicare Part B, 6 different levels. And the low level, and I'm not saying, like poor people level, I'm not implying that, I'm just saying the lowest income level is what we refer to as the threshold. All right, so the threshold this year, because these change every year, it bumped up a little bit for 2025. The threshold for a single filer is $106,000 modified adjusted gross income, 106 or below. Anything there, you will not have the surcharge, which is referred to as an IRMAA. IRMAA is an acronym which stands for IRMAA, IRMAA, Income Related Monthly Adjustment Amount. So if I'm a single filer and I make $106,000 or less, I will not have an IRMAA. I'll have no surcharge at all. Now, if I'm a married couple that files a joint return, not a separate return, but a joint return, then that number is doubled. It goes to $212,000. So if I have, back in 2023, if I'm on Medicare for this year, 2025, if I'm at 212,000 or below, then again, I will not have the IRMAA surcharge. So that's the thresholds for this year. So again, single filer below 106, married filing a joint return below 212, you will not have to deal with any kind of an IRMAA or surcharge. You will only have to pay what is referred to as your base premium. Some people call this the standard premium. And this is about what about 85 to 90% of all people pay, the standard base premium. And so this year for 2025, that is $185 a month. $185 a month. And that formula basically is you're paying 25% of what the government estimates them to cost, what they're estimating it to cost them to cover you for Medicare Part B. Let me say that again. If you have no IRMAA, you're paying the $185 a month, the standard premium. You're paying 25% of what the government believes it's going to cost them to cover you for 2025 for Medicare Part B. You pay 25%. The government pays 75% of that estimated cost. Okay, so what are they saying? They're saying that they believe as we go into 2025 now, that it's going to cost the federal government to cover you for Medicare Part B $740. But if your income is below the threshold, 106 or 212, then you're paying 25% of that and they're paying 75%. But what happens if we're above those thresholds, so above 106 or above 212, then the government begins to add additional premiums to your Part B premium. So you're going to pay above 185. And so there's actually 5 different levels. I'm not going to get into every single one of those. That would take too long for today's session. But my point is, if we're above the thresholds, then we have 5, we'll call them marginal tax brackets. So 5 different levels of IRMAAs. Okay. Now, the highest level this year would be anyone, and I've got my chart with me here, anyone that is individual that makes above $500,000 modified adjusted gross income, or a couple that makes above $750,000 modified adjusted gross income. Each of you then would not only pay the $185, but you would also pay the IRMAA. Okay, so let me say it again. Above 500 single, above 750 as a couple, you're going to have an IRMAA. On the B side of $441.70 a month. So we take that IRMAA, I'm sorry about that, $441.70, and we add the base premium to that, and that gives you a Medicare Part B premium of $626.70. And what that means is this. You are paying 85% of what it's going to cost the government to cover you because of your high income. They pay 15%. You pay 85%. So the whole point is when they add these surcharges, the government's saying, we're not going to pay as much. If you get above 106 or above 212, you're going to start paying more. And the government says, we're going to start paying less. All right? And so that's the highest IRMAA level. Now, here's what I want you to understand. If you have this kind of income, not only are you going to have an IRMAA on the B of Medicare, but you're also going to have an IRMAA on the drug plan. So when you enroll in the drug plan, if you're no longer working or don't get your meds to the VA or TRICARE, then you need to get a drug plan. And so they're going to have an IRMAA attached to the drug plan as well. So if you have a B IRMAA, you always have a D IRMAA, always. All right, and so the high D IRMAA this year is $85.80, $85.80. So we have the B IRMAA of $441.70, we have the D IRMAA of $85.80. And so that number combined is exactly what we gave you in our titles. That's $6,330 extra a year because of your high income. Why? The government's saying we're not going to pay as much. You're going to pay 85%. We're going to pay 15%. All right, so that's the highest IRMAA. Let me just talk about the middle one, and if you have other questions, I'll answer those in between. So that's the highest. Let's talk about the lowest IRMAA. So this is someone that is a single filer, and they're between 106 to 133. Or they're married filing a joint return, and they're between 212 and 266,000. That's the lowest. So that'd be the first marginal bracket. And that IRMAA would be $73.60 on the B and $13.70 on the D. So it's a total IRMAA of $87.30 a month. Not near as high, of course. So they're paying a little over an extra $1,000 a year. So it just starts going up as our income goes up until we go, get to that highest point. So again, we have 5 marginal brackets. Anywhere the lowest amount is about $1,000 a year, highest amount over $6,000 a year. And again, they're looking back 2 years to determine that number. Now, last thing I want to mention here and teach you about, then I'll get into the questions. And that is that if you have a qualifying life-changing event, and that qualifying life-changing event has caused your income to be reduced. They looked at 2023 and they want to charge you of IRMAA. But if you had a life-changing event in 2024, or it's going to happen in 2025, once that life-changing event has occurred, you have the opportunity, the right, to actually have an appeal of the IRMAA, or it's called a reconsideration of the IRMAA. They automatically look back at 2023. But if your income has changed in 2024 or will in 2025, we can actually project that number, and they will either reduce your IRMAA if you go down to the thresholds or lower, or if you maybe move down a couple levels. So instead of paying $6,000 a year in IRMAA, maybe you'll go down to $1,000 a year in IRMAA. So you may still have one, but it is well worth your time to appeal that IRMAA and ask for a reconsideration. So there's only 8 life-changing events. The most common ones that are used are work reduction. You're no longer working as much as you did in 2023. That has affected your income. Or work stoppage. You fully retired. And again, this, if it's a husband and wife, it's just one of you retired, and that's affected your income. That is fine. Both of you can appeal. So you want to take the time to appeal. Now listen, if you're our client, we'll walk you through this process, make sure you know exactly what to do, kind of the ins and outs of the IRMAAs. We do that for our clients, no charge at all. Happy to help you do that. But you appeal the IRMAA, one of 8 of life-changing events. So work stoppage, work reduction are the most common. The next couple that do happen would be if there's going to be a death or a marriage or a divorce, death, marriage, or divorce. And that, of course, those could certainly affect your income. So if you had a death, divorce, or marriage, and your numbers have changed because of that, then again, you can appeal that. You can say, I got married in 2024. You all looking back at 2023. All we have to do is produce a marriage license proving you got married in 2024, and they will reduce the IRMAA or drop the IRMAA. Work stoppage or work reduction, you don't have to have any proof of that. You can if you want. But those two, you just sign an affidavit saying, I'm giving you actual numbers, and they'll take your word for that. You need to be truthful about that. If someone has a divorce, then you're going to have to prove a reduction of income with the divorce decree. Or if there's a marriage, you may have an IRMAA as a single, but you got married and now the income is 212, and together you don't have an IRMAA. So you'd have to produce that marriage license, the divorce decree, or if it's a death, spouse dies, that could affect income. We just produce a death certificate, and that's proof, and then we can get those IRMAAs either eliminated or reduced. And the form that we use is called an SS-44. SS-44, and that's the reconsideration or the appeal of the IRMAA. All right. Now, there are 3 other life-changing events. I personally have never had to use these, but I want to mention them just so you know. One would be a loss of income-producing property. That does not mean you sold the property and took a loss. It means that property, burned up, or slid down a mudslide or something. It's gone. You no longer have that property you did in 2023, but you have lost it now because of a natural disaster. You'll have to have insurance to prove that, of course, but that's one way. Loss of pension income, loss of employment settlement agreement, which means you no longer have that income that you did because that pension plan went bankrupt or reduced payments or whatever. So those are the 8 life-changing events. And so if you've had one of those, again, in the last 2 years, you can ask for reconsideration and appeal. And that same event can be used for 2 years. They automatically look back 2 years, so they give you the chance to look forward and use that event for 2 years. All right, so that's what we're talking about when we're talking about this hidden cost. A lot of people don't realize IRMAAs are a reality. You got to deal with it, but again, you do have the right to appeal if you would like. All right, so hey, I know that was lengthy, but it is a reality. Some of you are going to have to do this, about 10 to 15% of you, so I hope that's helpful. All right, now let's get to the questions. Our producer is Daniel, and he's going to be feeding me the questions, and let's get started, Daniel. I'm ready. All right, now the price is going to skyrocket for N and Part G. Well, Ani, we don't know for sure if they're going to skyrocket. I will say this to you, though. By the way, for those of you who may not know what she's talking about, these are the 2 top supplemental plans on the market today. Plan G, about 70% of people buy that. Plan N, about 30%. So these are your primary popular supplemental plans. And so what happened was in 2023 and 24, we did see some fairly I'll say sizable, comparatively speaking, increases on N and G because there was a readjustment of the market. COVID, a lot of people were getting healthcare services. And so we just didn't see a lot of activity there after. But now since COVID, people gone back and they're doing their elective surgeries and all different kinds of things. And so we're seeing more healthcare services plus medical inflation, and that has driven those prices up. We do believe that all of that was just a correction in the market. So as far as skyrocketing moving forward, we don't think so. I'm not saying there won't be increases, but I think we'll get back to that range where we were before, in that range of anywhere from about 5 to 10% on an annual basis. All right, so I don't think they'll skyrocket, but I would anticipate them going up. However, that's why we take the time to at least look at the history of these companies before we make a decision, because we want to go with a rate stable company. They all go up, but some go up more frequently, more drastically. And so we have found the national plans, larger companies, larger groups typically tend to be a little bit more stable than your smaller regional type of carriers. All right, let's keep going, Daniel. Okay, Sue says, does disability count towards quarters earned? Okay, no. And if you're receiving disability income, that's not count. What's going to count towards quarters would be what is going to be subject to your FICA or self-employment taxes, and so it's not. If I understand your question, so we get quarters by accumulating taxable income. So if you're already receiving disability income, then that's not going to give you more quarters. You actually have to be working to do that. Now, you do have to accumulate enough quarters to even be eligible for disability, but it's not going to count toward the quarters. Okay. All right. Richard says, had an HSA in 2024, turned 65 in March of 2025. Can I wait until June to apply for Medicare to avoid being taxed on my 2024 HSA deposits? Okay. Here's what's going to happen. Richard, if you wait until June, what they're going to do is they're still going to backdate your A date to March, because once we enrolled into Medicare, the A date is always backdated to age 65, or it's backdated 6 months. So if you enroll in June, you're still going to have an A date of 3/1/2025. So the only way that you can, if you want to start in June, that's not going to help you. So what I would recommend doing, if you're contributing to an HSA, 2024 is fine. Okay, you are turning 65 in March. So here's what I would do, Richard. I would do the max contribution for January and February. So if you're going to start Medicare June 1, 2025, you can request a B date of June, but your A date's still going to be 3/1. So I would stop your contributions after February, especially if you're maxing. Now, I don't know what the new numbers are, and I'm sorry. I had those memorized for 2024, but what the max was individually $430 a month. That was $4,150 a year plus $1,000 a year catch-up divided by 12, so $430. So I would assume they raised that a little bit for 2025. So as long as you're putting in that, probably that, let's call it $440 a month, $880, you're still going to be fine. You just don't want to overfund your HSA. So it's the A date that determines when you're no longer eligible to contribute to a health savings account. It's the A date. All right, let's keep going, Daniel. Okay, D, I will be living in a different state for 1 year when I turn 65. Do I have to use the programs in my temporary state, or can I use providers in my home state? Okay. Okay, well, first off, D, if you go on a Medicare Advantage plan, then you're probably going to have some issues if you try to do, because Medicare Advantage plans have networks. And so it looks like to me, if you're going to be one place and move to another, you're going to have to not only find new providers and make sure they're in the network, but once you move states, you're going to have to get a new Advantage plan. However, if you make the choice, which I think is the best if you can afford it, to enroll in A and B and get your supplemental plan, your providers are not going to matter, because original Medicare A and B and supplemental plans do not have a network. So you can go to any provider, any hospital, any doctor, any specialist, as long as they take Medicare. So D, as long as you can afford that little extra monthly premium, this will be no concern whatsoever. Only if you do an Advantage plan are you possibly going to have issues. Now, I'm not saying you can't work through this with an Advantage plan, but there are going to be some additional hassles that you would not deal with if you had a supplemental plan. All right. Okay, Bruce, can I switch from Plan F to G provided I pass underwriting? Yes, sir, you can. Yeah, in fact, Bruce, you can do that at any time. We are not bound to the open enrollment dates, October 15th to December 7th, on supplemental plans. That's only Advantage plans. So Bruce, if you're on an F plan, you can medically qualify, you can move to a G anytime you want. In fact, sir, I would do it ASAP. Your health could change in a month or two. And so if you'd like us to help, we write in all 50 states. You can call in. We'll look at the G rates and look also at the carriers because we find that some carriers, in fact, I'll give you a great example. We have some carriers that won't even look at you if you have AFib in your medical records, and even one time. But we have some carriers that'll take it as long as there's been no medication changes, and there's been no other issues. So the point is, we're, as brokers, we get to actually look at all the different carriers and find someone that would take your situation. Because I had a doctor just recently, we had to go through underwriting, and he had spinal stenosis, and one carrier declined it, and another one, they were fine with it. So that's the point. Just be sure that you know that just because one carrier says no doesn't mean they're all going to say no, and we can help you with that as well. Give us a call. Okay, let's keep going. All right, Tim, is there a good place where I can go double check the accuracy of my Social Security payment? Yes, sir. Yeah, you should be able to go on to your myssa.gov account. So ssa.gov, and if you have set up your myssa.gov account, you ought to be able to go in there and look at your earnings history, because all that should be available within that system. If it's not available, then Tim, what I would do is I'd call your local Social Security office and ask them how you can access that information. But you should be able to do it on your MySSA. If not, call them and they'll tell you how to do it. Even if they have to order the information, you can get it that way. All right, Tim Summer. I quit working August 2023, started taking Social Security 2024. They charged me an IRMAA charge based on taxes of 2023, which is true. I filled out an IRMAA form and was denied. Why? Can I appeal? Income is less than 80K 2024. Okay, and by the way, I'm going to answer your question, but for those of you that are writing in, be sure, this is not a text. I know sometimes when we text, we try to abbreviate things, so be sure when you ask me a question that I may be in your head, but be sure I can read it and understand the question. By the way, I think you've done a good job, but don't be when you ask me questions, don't be so summarized that I can't figure it out, because then I can't help you, and that's frustrating to you as well as to me. Okay, so let's go through it again. Quit working 2023, started taking good. They charged me an IRMAA based on tax, which is true. Okay, I filled out an IRMAA form. All right, so again, I don't know why they denied you. I wonder, did you fill it out correctly? Did you check the right box? Did you give them the right numbers? Because what you should have done was given them then your 2024 income. And so I just don't know how you filled that out. But listen, honestly, you all, I have never seen people that we've helped. I've never seen an IRMAA appeal denied if the paperwork is filled out properly. So I would do it again. So you're saying, can I appeal income is less than 80K in 2024? I definitely would, for sure. So use your 2024, but you got to keep this in mind. Your life-changing event, if it happened 5 years ago, can't do that. So that life-changing event had to happen for you either in 2023 or 2024. And it sounds like that happened, but just because you took Social Security, that's not a life-changing event. That's not the issue. And I know your Social Security is not high enough to be charged an IRMAA. So I have to ask what happened, what life-changing event occurred. Is it one of the 8? If it is, give them the accurate information, make sure your paperwork's filled out correctly, and refile it. Okay? Okay, Daniel, let's keep going. Richard, should you apply for GRN as soon as you turn 65? I would. Richard, the majority of people that we work with are normally calling in, setting up appointments anywhere from about 3 months to 6 months prior to going on Medicare. And that's a fine window. Now, you can do it 2 weeks before you turn 65, but we think the best time frame is that 90-day window, and even further in advance if you want. 30 days to 6 month range, you can start applying. And the reason for that, Richard, is let's say my Medicare is going to go effective 2/1 of 2025, this next month, then I can have done all this paperwork well in advance so that my Medicare starts 2/1/2025, but so also does my drug plan or my supplemental plan or my Advantage or whatever I'm going to do. So do it in advance for sure, so it's fine. All right, Daniel, let's keep going. Ron, currently retired and have Part A. My wife is still working, so I'm currently on her medical and dental insurance. Is this the best solution for my situation? Well, Ron, it could be. And if it's not costing your wife more to cover you on her group plan than what it would cost you to be on Medicare, then it is a good decision. So if she has a great plan and it's lower cost than Medicare, then I would tell you what you're doing is wonderful. I'd stay on that. Now, the only caveat I'd say here, though, we want to make sure that your wife is employed by somebody that has 20 employees on the payroll or more. Because if we have 19 or fewer on the payroll, then you have to enroll in a Medicare A and B at 65. But as long as your employer is large, Medicare says 20 or more employees on the payroll, then what you're doing is fine. Now, let me explain, Ron. What I would do is this. I don't know where you're in income. Let's assume you don't have an IRMAA. Let's assume as a married couple you're below $212,000. We know your Medicare Part B would be $185 a month. I don't know what drugs you take, but let's say you got a $25 drug plan. Now we're at what, $210. And then if you get a supplemental plan G, let's just add $150 to that. So now we're at $360 a month. If you got an N, you may be at $320 a month. So if it's in that range of $320 to $360, where we can get Cadillac insurance, A and B supplemental plan, drug plan, and your wife is only costing her to cover you $100 a month or $200 a month, then stay right where you are. But if it's costing your wife $400 or $500 a month to cover you, then I would get off the group plan and then I would go on Medicare. All right, so that's what you have to do. You have to compare. Your situation's fine, but you got to make sure it's the best situation financially. So she has a great value, low rates, all that, stay right where you are. If not, shop it. Okay, let's keep going. All right, can I have an FSA on a supplemental plan? Yes, you can. The only thing you can't have when it comes to Medicare, now supplemental plans, they don't care about anything when it comes to what you're asking. But Medicare says if you have Part A or B or both, most people, on Medicare both, you cannot have an HSA. Once we have Part A, no HSA money. You can use your HSA money to pay for all your medical expenses that are necessary other than premiums for Part supplemental plans. But when it comes to flexible spending, it is fine. You can do really anything you want with your flexible spending because that there's no tax, ongoing accumulation of value to FSAs. That's use it or lose it. So if that's what you meant as a true FSA, it is fine to use that flexible spending account on whatever you want to. And the supplemental plan is fine. You have it. Medicare is fine if you have that, just not an HSA. Because flexible spending, you set aside a certain amount a year, $2,000, $3,000, you got to spend it or you lose it. All right, let's keep going. So you're fine with that? The answer is yes. Cindy, my question is, if Medicare costs $185 a month and I pay it myself while still working, what happens when I go on Social Security? Do I lose $185 a month from it? Yes, you do. Because once you're receiving Social Security benefits, your Part B premiums will come out of your Social Security for sure. Okay? And just so you know, listen, it is $185 a month, but if you are paying it direct, they don't send you a bill every month. They actually send you a quarterly bill if you're not on Social Security. They also have another system where you can do auto drafts from a bank account, and then that would be monthly, but they're not going to send you a monthly bill. That's a quarterly bill. Okay, let's keep going. Jackson, my supplemental plan is with Ascendo Insurance, an Aetna affiliate. I've been hearing a lot about Aetna. Healthcare is having trouble. Should I be worried? I don't really think so. My only problem with Ascendo right now is, and you probably know this, but I don't think Ascendo is being offered in very many states, if any longer. Aetna has actually pulled that block of business, so that doesn't mean you're in a bad position. But the issue with that Ascendo block is it's shrinking, and so what you may want to consider doing is requalifying for another Medicare supplemental plan and just switch. But I still wouldn't be concerned about Aetna. I think Aetna is just as solid as United Healthcare, as Mutual of Omaha, as any of the Blue Cross Blue Shield Anthem groups, Cigna. So I don't think we can say that you're in a bad position because you're with Aetna. All the insurance companies are having issues in one form or another. Okay, so I would not be afraid of Aetna, but I may be a little bit more concerned about Ascendo only because I know there's no new money going into that group. That's the only reason. So if you can get off of it and medically qualified, then you may want to switch. But that's the way I'd handle that. But I wouldn't panic over it because I don't think you're in a real bad position. But that Ascendo block just did not last very long, just a few years. All right, let's keep going. Patty, I was denied for Sup G because my doctor rated me at a 2 out of 5 on some scale for kidney disease. Is it worth trying a different company? Well, Patty, the question is have you been diagnosed with some form of kidney disease? And it sounds like that's going to be yes. And I don't know of any carrier that is going to take that. Now, Patty, what you may want to do, and I want you to know something. I'm not suggesting you do this, but you may want to. I don't know if you're on a supplemental plan already or on an Advantage plan and you'd like to get off the Advantage plan. I've had people who had one health issue that went with United Healthcare, got through underwriting, but they had to pay a higher rate. United Healthcare is one of the companies, because very few do this. They actually they have a standard rate, which is the rate you really want to pay. But if you answer yes to one health question, such as kidney here, and only one, then they still will write a plan, but you have to pay a higher rate to do that. Now, most people don't want to pay the higher rate, but I've had clients do that, meaning they wanted a supplemental plan, they wanted to get off the Advantage, they couldn't get approval anywhere else, and so they went with United Healthcare at that higher rate. It's just like a tier 2 kind of a rate. So that may be an option for you. So 2 out of 5. I don't know. And again, I'm not sure what the doctor would say. Whoever denied you, I'd be curious. Did you appeal that? But I think any form of kidney disease is not going to be acceptable unless maybe United Healthcare would look at it in that one health question. So hey, if you want, give us a call. Talk to one of our agents about that, Patty. They'd be very, very fluent in being able to answer your questions specifically after we've asked some of the other health questions as well. All right, so I couldn't provide more help. All right, Nanner. Husband and I own some commercial rental property. He's disabled, and that is our only income because his SDI. When we sell the building, does that count as loss of income, or would it be an increase? Well, when you sell that building, if you're going to make a profit on that, that's more than likely going to be a capital gain. That capital gains number is going to go into your modified adjusted gross income. So if you sell it this year, then that's going to affect what you're going to pay for Medicare. Now, when you talk about SSDI, I know you're talking about Social Security disability, and so I think the only income they count is when you're actually doing some form of work. So I don't think that's going to have any impact with your Social Security disability payments, but the sale of a piece of property and the capital gains with that could certainly affect what you pay for your Medicare B for 1 year. Okay, so if you sell it this year, you're going to see that come up in 2027 because they're going to look at 2025. So you may have an IRMAA for 1 year. Next. Okay, Captivatus. If I still need Medicare quarters qualified, can it be part-time? Absolutely, for sure. The quarter this year is $1,810. So let me explain. We cannot get more than 4 quarters in a year, but we only have to make this year $1,810 of gross income. That would be W-2 income, net self-employment income. And as long as you have $1,810, then you picked up a quarter. So that means this year you have to make $7,320 to make 4 quarters. So if you make that in a month, you got your 4 quarters. You make that in 3 months, 4 months, doesn't matter. Because it doesn't have to be per 3 months. It just means the accumulated amount for that year will determine how many quarters they give you. They don't give you any more than 4 quarters. So you take 4 times the 1810, and that's what you have to make to get 4 quarters in 1 year. The point is you have to work 12 months to get 4 quarters. You just have to make that specific dollar amount. Okay, I hope that helps. And by the way, and also, Captivate us, hey, if you're married or were previously married, there's rules for we can actually get from an ex-spouse, even a deceased spouse. So some of those kind of things would apply as well. Not sure of your situation, but we always look, if we can't get our own 40, to a spouse or ex-spouse, and then if not, go back to work and try to get the 40. And it's well worth your time to go back to work and get that. If you're really close, please do it, because if not, you're going to be paying for A your whole life. And so I'd rather go back to work, even a part-time job, get those 40 in, and that way I get Part A, 0 premium for the rest of my life. And so that's a good use of your time. All right, let's keep going, Daniel. Okay, Nanner, advice on finding a good financial advisor. Well, call us. We do it all the time. Happy to help. I mean that. We are fiduciary, Series 65 license, which means that, of course, we have to do what is in your best interest, not ours. And so that's the way we approach financial planning. And again, we're very holistic. We don't think one size fits all. Everyone needs their own specific plan based upon their goals, their budget, and their investments. And so we have to take a very holistic approach. But just call our office and just let us know that's what you want to talk about, and our agent can direct you, and we can get that process going. And by the way, there's no cost for that. It's just part of what we do for our clients, because it's called assets under management, and so we're paid that way. But the point is that there's no cost for the plan itself, and we'd be happy to help you. All right, let's go. How long does the IRMAA last after retiring from active work? Well, if you're high income, you could have IRMAAs forever, because it's not about active work that causes the IRMAA. Now, if your income is high because of active work, then you should have those IRMAAs come off within 2 years. But I would even have it come off sooner than that. If I'm working in 2025, I know that is going to affect my income my IRMAA in 2027. But if I retire, I would appeal the IRMAAs and get a reconsideration. So if you have a life-changing event, work stoppage, work reduction, that causes your income to go down, then you appeal. But I have lots of clients that they're still retired and they still have IRMAAs. They're no longer working just because they have a lot of investments, and so their income is still up. So it's the income that causes us to have IRMAAs. But if that income changes because of work reduction or work stoppage, then we have the right to appeal it if our income is down because of that. So I hope you understand what I'm trying to communicate. I have lots of people that still have IRMAAs and they no longer work. Why? They just cut lots of investments and that income stays up there. Okay, let's keep going, Daniel. All right, can you explain why it shows my Medicare Advantage plan on the Medicare site is null, as if I have on no Medicare Advantage? It should show my plan in the lower left box on the Medicare page. Well, Larry, do me a favor, especially if you're our client, call in and let our staff go in and look at that to see the status of that. Now, we just came out of AEP, so all the new plans are going to affect January 1. So why it says no, I'm not sure. That would be a new one on me. But if you're a client, call in, and our customer service team will go in there and we'll make sure that your plan is active. And even if you're not, Larry, you can still call in and just tell the switchboard that Marvin said that you get some help verifying the status of your Medicare plan, and someone could look that up real quickly, because the site that we have access to is going to show us your status for sure. We'll know exactly what your coverage is for January 1, 2025. They'll identify the company as well. Okay, let's keep going, Daniel. All right, I just started Medicare and chose Plan G. I'm second guessing myself, and I'm wondering if I should drop to Plan N. My concern is I do have health issues, and I know I'd never pass underwriting. Well, listen, by the way, tomorrow is my birthday. I'm going to be 64. And so I got a year before I'm on Medicare. But I still would choose a Plan G in my area. My office is in Kansas, but I live right across the state line in Missouri. And so the difference in G and N in my area is only about $35, $40 a month. That's it. So I'm still going to go with the G plan if things stay as they are. So if I were you, wouldn't be second guessing myself. Now, if you live in a state where there's $80 to $100 a month difference, then I may look at an N plan. But because you have a G plan, I don't think you made some kind of mistake at all. The N's, I know, have a little bit of a lower rate. Long-term stability, we're still unsure about that. I know there's some that are real dogmatic about that, but the point is, I don't think it's a mistake having a G anyways. I also don't think it's a mistake getting an N. So if you want an N plan, move to an N plan. I don't think that's a bad decision at all. I like the G because in case excess charges, that system were to change in the future and we saw more of that happening, I got it covered. Now, right now, it hardly ever happens, so there's really not a lot of risk involved. But I'm sharing this with you because you say you have health issues. So if your health changes and you get 6 months beyond your B date, you're going to have to medically qualify to pick up that G plan, which would be impossible. Now, if that difference in premium between G and N is going to be substantial in your budget, then take an N plan. It's not a problem, really. They're both wonderful options. They are. But second guessing, I just think that's natural for us to do that because, until our plan goes effective, we just kind of second guess a lot of things that we do. So that's my answer to you. Drop to an N if you want. I don't think that's a bad decision, but if you stay with the G, I guarantee you that's what I'm going to do for now. Let's go. All right, Jeanette here. When I transitioning from disability and survivor's amount to full retirement, okay, SSA said they made an error and they increased my amount $600 a month, so they can get away with that for the last 8 years. Yeah, they can. That really stinks. Yeah, so I'm assuming then what they're doing is they're making you pay that money back. Yeah. And I definitely have seen that before. They make a mistake, and you have to pay for it. And the truth is, they still gave you money they should not have. So they do have every right to recoup that money. So I am sorry to hear that happened to you. That's a real bummer. So if you're convinced, even though they made the mistake, it really still was legitimate numbers, I don't think you have much recourse on that at all. All right, John, just started a new RX plan on my supplemental plan G. Do I need to inform Medicare about this change? No, not at all. Drug plans are separate from supplemental plans. So if you chose a standalone drug plan, the plan that started January 1 automatically kicked out the one you're on for 2024. So you don't have to notify anybody. As long as you received your new card on that new drug plan, all is fine. Okay, don't worry about it at all. You're good. Have not received a Medicare card for Part B. How long does it take? Well, I would say minimum of a month, and I've seen sometimes as much as 8 weeks. Now, Gail, if you're our client, you can call in, and we have access. So once you've applied, usually within 2 weeks, we can go in and find that number. You may be able to find it on your own, possibly through your myssa.gov account. But the card itself could truly take anywhere from 4 to 8 weeks. So the issue is, if you have a doctor's doctor's appointment or something going on, you need that Medicare number, and you're our client, call in and we'll get it for you. If not, you can always call Medicare and tell them you haven't received your card yet. In fact, let me back up. I would not call Medicare. I'd call your local Social Security office and let them know you haven't received your card yet and see if they can expedite that process. Okay, not Medicare. Sorry about that. Local Social Security office. Or our client, call us. All right, I'm 65 in August. When should I call to apply for Medicare? Michael, back up the clock 3 months. So if your birthday is in August, let's go back July, let's go back June, let's go back May. And so I'd be doing anything around April, May range is perfect. You can do it some states. We can do it 6 months in advance. But definitely that April, May range is perfect for you for sure. Okay, so and again, you can do it earlier if you'd like to. It's fine. Call in now. Set an appointment up. It's no problem. We can at least get the ball rolling and make some progress. Drug plans are all out for this year. We know the supplemental premiums for most of the companies now for this year. So really, anytime you're comfortable. But I think right now, just a tad bit early. But again, 4 to 5 months. Okay, let's keep going. Thank you, Michael. We'd love to help you. Call us. Chanks, is it an option for seniors to refuse drop Medicare and switch to healthcare marketplace? No, you would never want to do that. And I'm going to tell you why. Because once you're Medicare eligible, the financial benefits of the healthcare marketplace go away. So you will not get a reduced premium, any cost sharing, and tax subsidies once you're Medicare eligible. So trust me, there's no reason. I know ACA plans, healthcare plans can be very attractive prior to 65. Sometimes people get them at very, very low cost. But once you hit 65, all the financial incentives go away. The government says we are not going to subsidize you on 2 different types of plans. And so you're going to get off ACA and you're going on Medicare. I know it may cost you more, but trust me, you will not want to be on an ACA plan once you're 65. Keep going. All right, Danny, how does the birthday rule work in California for Part D? I don't take meds, but was too lazy to swap out WellCare. Okay, well, birthday rule has nothing to do with Part D plans at all. Birthday rule has to do with supplemental plan switches in California. And I think California is 90 days, if I'm not mistaken, from the birthday on. But they have a certain period of days around your birthday. Sometimes it's 30 days before, 60 days after. Sometimes it's 30 days around your birthday. But whatever I think, like I said, California, I think it's 90 days. But that is for switching supplemental plans like to like, G to G, G to N, like to less. So it's for switching supplemental plans. It has nothing to do with drug plans at all. So your dilemma is the time to switch drug plans, October 15th, December 7th. So you miss that enrollment opportunity. And so I would just tell you, I don't know, that you're going to switch your plan. But listen, I think you're fine. Keep that WellCare plan. WellCare stopped working with brokers, so we're disappointed in that. We can't write those plans anymore. But I still say you're fine. So don't worry about swapping. Just keep your WellCare plan. Better than nothing, okay? Now, when it comes to healthcare, well, then you have a G plan, and you just had to be at that time of the year where your premium increased. So I would just suggest you stay right where you are. Now, if your birthday rule is coming up and you want to switch plans, then let us know about that. We can assist in that process. But your drug plan, I think you're fine. Okay? Hopefully your meds are covered well, but you can't change that drug plan now. Okay, what are good ways to shop for drug prescription insurance? Well, a couple ways. If you are our client, we have a website that our clients go to every year to look at plans that we write, that we have vetted, that we're comfortable with. That is MedicareSchoolEnroll.com. MedicareSchoolEnroll.com. It's all for drug plans. If you're not our client and you would like just to do this on your own, then I would go to Medicare.gov. Medicare.gov and tell them you're looking for a drug plan, and you'll have to, of course, put your medications in and all that. So that's another site that you can use. So we have our site for our clients, MedicareSchoolEnroll.com. And the other one would be Medicare.gov. All right, that's answer to your question. Let's keep going. All right, I am 100% disabled veteran. I'm receiving VA care, via community care. Good. I've signed up via your office for A, B, G, and D. Okay. Well, it is our privilege to help you. And thank you for trusting us. We take our responsibility to be your broker very seriously. So please let us know if ever you need anything. We'll help you. Okay. So you sign up for Medicare via your office, and because travel, can doctors bill both Medicare and VA? And so the question of that is they won't, okay? That's not going to happen that way. So the VA, if you're seeing doctors there, they're not going to bill Medicare. Medicare is not going to pay them. It's a different government entity. You qualify for VA benefits because you served in the military. Medicare, we qualify because we paid into the Medicare tax system for at least 40 quarters. So you have two different types of insurance there. If you see a civilian doctor, someone outside of VA, VA's not going to pay that. Well, they may, but if I'm outside VA, then I'm going to use my A and B and my G plan. I'm not going to get VA involved whatsoever, if it were me, because you have that civilian option. Okay, so hopefully that answered your question. Sorry about that. I didn't catch the whole thing in the beginning. All right, Don, wishing you, Evan, and the entire Medical School a very happy New Year. Evan has been incredibly helpful getting me signed up. Very good. All right. And yeah, go Chiefs. We love the Chiefs. Don, thank you for letting us serve you. And by the way, Evan is a superb guy. He's a gentleman and he's a Medicare professional. So we love him, and I'm glad you've been served well by him. Good guy. Okay, let's keep going. Jit, I will be 65 in April. Which should I apply for, or when should you apply for Medicare? Right now. Back up the clock. You're in April, March, you're fine. You see the 800 number that's going across the screen there, 833. Call that number and we'll walk you through the whole process. And keep that in mind for all of you. We help people enroll in Medicare A and B all the time. Now, if you're on Social Security, you're going to be automatically enrolled. But if you're not, then you have to do that enrollment, and we're happy to do that for you. Don't charge you a dime to do it. It's just part of the service that we provide as your broker. All righty. In a year, we'll start age 70 Social Security payments, and in 3 years, sizable required minimum distributions. Yep, RMDs. As all the 401k RMDs flow to the bottom line for taxable income for IRMAAs. Absolutely. Yep, it will be. Yeah, if it was Roth, it would not. But it sounds like most of these distributions are money that went in pre-tax, so your regular 401k, IRA type plans. Then when that money comes out, it definitely is going to affect your income, which will then affect your IRMAA. Now, I know that's disappointing, but I remind people, IRMAAs are a wonderful, wonderful, wonderful problem to have. Okay, that's right. So if you have an IRMAA, that means that you're making great money. So I know it's a pain and it's additional tax. You pay enough taxes, but still, I'd rather have the income and have to pay an IRMAA than not. Okay. All right, Glenn, are you contracted to write supplemental policies from all insurance companies? Well, Glenn, the majority of them. There will be a few carriers out there that we're uncomfortable with. They haven't been around long enough, or they don't write enough policies to really give good stable rates. So there's some that we choose not to write for that reason. They just don't have a good reputation. We don't like their rate stability, those kind of things. And there's a couple of those, but the majority of them, yes, sir, we do write them. Okay, I just can't say all. The majority, yes. Okay, Martin, do supplemental plans cover prescription or dental or vision? And the answer is no. Supplemental plans are supplementing original Medicare A and B. Now, when it comes to prescriptions, that would be Medicare Part D plans. However, that being said, A and B and supplemental plans will cover prescriptions that or medications that are professionally administered in the hospital, outpatient setting, chemotherapy, those kind of things. Yes, A and B in your supplemental plan will cover. But your self-administered meds, heart meds, high cholesterol, blood pressure, insulin, those kind of things, you self-administer those meds, that's covered through Part D plans. Supplemental plans are not going to cover dental or vision. Now, let me back up. Let me say this. Dental is not covered by Medicare except extreme cases. So that's not covered by supplemental plans. But vision is covered very well by A and B and your supplemental plan. Okay, very well. Glaucoma, cataracts, macular degeneration, disease of the eye, all that's covered by Medicare. What Medicare doesn't cover, and therefore what your supplemental plan will not cover either, would be only two things: eye exams for eyewear and eyewear itself. That's what Medicare and supplemental plans do not cover. But everything else vision related, they're going to cover. Okay, let's keep going. Good question. Your opinion on Humana, solid company. Listen, I'll say this. I'm definitely not afraid of Humana. I wouldn't shy away from Humana. Okay, so you asked me just about them. I would say you're fine. Now, before I make a decision, I'm still going to look at everybody else in the market to see what they're offering. But by saying, I wouldn't do Humana, I wouldn't feel that way at all. Now, I would tell you this. In the past, when it came to Humana supplemental plans, they were not really competitive, and they bugged people to death to get off their supplemental plan and go on Advantage because it's in their best interest for you to be on Advantage plan. So that kind of annoyed me about Humana. But as far as integrity and service and all that, I would not shy away from Humana. I would not. But still shop all the others to make sure it is your best option. Alrighty, let's keep going. If one applies the last month, if eligibility 3 months after you turn 65, do you have to pay bill all the way back to your B? No, you don't have to, because here's why. Joyce, if you apply those last 3 months, they're only backdating the A date, and there's no premium for A. So if you apply, let's do it this way. Let's say your birthday is this month, January, and you're still in your IEP, February, March, April. And you apply in April, that very last month, your B is going to start in May. So B is not backdated. A is backdated. And A is free for most people, zero premium. So no, you're not going to have to pay that. And then your drug plan as well. If I enroll in a drug plan in April, it's going to start May as well. They don't backdate the drug plans. Those are always starting the month after you enroll into them. Okay, so you should not have any issue whatsoever. Okay, let's keep going. All righty. Okay, I guess that is all the questions for now. Keep in mind, next Monday, this coming Monday, we'll have Medicare Monday at 5 o'clock Central Time. If you want to join in, go to our YouTube channel. Please call us if you need individual assistance. We are brokers, and we don't charge you a penny. Okay, folks, you'll not save any money doing all this by yourself. You're going to pay the same price whether you went direct, did it yourself, or use a broker. And the broker should bring a lot of knowledge, help, expertise, customer service to you, and that's what we do for our clients. So we'd be delighted to serve as your Medicare broker. If you give that privilege, give us a call, and then we'll see you on Monday, or we'll see you here in a week again during this event. Take care, and Happy New Year.